Hi, good morning, everyone.
Morning.
Welcome to Facebook.
Check
Got a
out
man
this
who
lad
will
over
make you
here.
smile. Okay, we're jumping live on air in just a bit, but hang tight because Dr. Mark going to answer some of your most deepest, darkest questions about dentistry.
Yes.
And your teeth. And it's going to lead you to a cool price as well. Hang tight, coming up live. The Commitments and Mustang Sally here on 1FM 91.3 Good Times Greatest Hits. Good morning to you. You're waking up on the Brightside or hanging out with us. Carol, Lavinia and Shehzad joined in the studio this morning by someone who will make you smile or improve your smile, Dr. Mark Fung. Welcome.
Yes, he is a general dentist at Smilepoint Dentist. He's been a dentist for over 10 years, originally from Hong Kong, but he spent 3 years already. Time does just fly past here. He enjoys family and general dentistry, and you can find him at 2 clinics, Smilepoint at Holland Village, Dental Plus in Teluk Blangah. And when he's not looking at teeth, I love this confession from a dentist, okay? He has a terrible sweet tooth. He appreciates making and eating all things sweet. And he also has a great love for travel and outdoors. In fact, we're going to hear of his recent hike in the Brightside Travels in the hour of 9 a.m. Welcome, Dr. Mark.
Hello. Thanks for having me. Hi.
So, Dr. Mark, tell us, what are some of the common misconceptions that people have about their teeth and gums? Like, I only need to brush once a week.
I think the most obvious one is you don't need to go to the dentist until something hurts. Because by the time something hurts, it's usually too late. Yes, and it becomes a bigger problem. Lots of things happen very silently, slowly. So it's very important to go get them checked every few months. Yes.
On that note, and you must get this all the time, why do we as humans, as people, why do we wait till the very last minute generally to come see dentists? Because you don't do that with doctors necessarily.
Yeah, I mean dentists don't have it fair, really. I mean, a lot of people are scared of us, right?
Yeah.
I'd like to think I'm quite friendly, but a lot of people would put it off because there's that stigma attached to coming to the dentist and like, oh, I'm going to come out with more pain.
Right.
Yeah. So I think people try to put it off until last minute, and then usually by then it's.
So more often than not, you are seeing cases that are too late in that sense. So you quite often...
Yes, a lot of times, yes. Even yesterday, 2 people came in, they wanted their tooth to be saved, but they had this cavity here for, I quote, 2 years already, but can you try and save it?
Oh
2 years! Not a chance, sorry.
I wonder what is the main thing that actually puts people off? I mean, because you as a dentist, most dentists are very kind, they're very helpful, they're very, patient. But I think it's the machines, right? All that drilling
yes. Unfortunately,
that people are afraid of.
Yeah, unfortunately, that drill is still around. It's been around for many years.
Can you do something about it?
Yeah, like come up with a new drill.
Yes.
Just play music instead of
silent one.
We play some nice music in the background.
Also, the size of the jabs that go into your mouth.
The needles.
The needle is so long.
You see, I'd always try and hide the needle from the patient before I do anything with it.
Look, what's that?
It's also the vulnerability, isn't it, of lying down and not really being able to.
Exactly. Kind of and you're laying down. You're trusting the stranger to come in with sharp objects and instruments into your mouth. You literally met me 2 minutes, and now you're laying down. You're in a very vulnerable position. A lot of trust is involved.
Laughing gas, more laughing gas, I say. That's the way forward.
Hey, that would be a great idea. You just flood your whole room. You're in a gas mask, which would probably scare them even more. But you flood the whole room with laughing gas, and then everyone's happy.
And everyone's happy.
I know.
Good day at work.
Have you tried this? Have you tried offering them a sweet before you start?
What?
Seems a little counterproductive.
Says the guy with the sweet tooth.
Therein lies the secret, you see, Dr. Mark. All right, we're chatting with Dr. Mark live on Facebook as well. Do join us there. Facebook.com/1FM 91.3 could lead you to a lovely prize from the Thai spa.
That's right.
Maybe that's what you need to do. I lie down, someone massages me while you work on my teeth. You're welcome.
I would go to this dental clinic if a
That's
massage
actually
was
really good.
I will take
think
that
about
back.
it. And if you think that, the massage might get in the way, just do a foot massage.
That's a great idea,
Thank me
I will
later,
take that
you
back
guys.
to my boss and
Thank
see
me
what
later.
she says.
It's later now. So you can win for yourself a 60-minute massage worth $100 from the Thai spa. It's either Thai or a Balinese massage. And then after that, go and visit Dr. Mark. Or maybe you go for Dr. Mark first and then you go for this Thai massage.
Do you have any throbbing questions about dentistry? Join us on Facebook. So maybe you have to rename. What's your dental practice called?
Smilepoint Dental.
And Spa now.
Smilepoint
Spa.
Smilepoint Dental Spa.
There is
This
something
would be
there.
the first dental spa in the world. I'm sure of it.
Actually. Yes.
You heard it here first. Trademark, Thai massage and dental.
Yes.
There you
So
go.
I'd love to thank 1FM and you guys for this.
Just remember us when you make your millions.
DJ, we can help you curate your music as well. You know, spa like
You
music.
said, right? Listen to some music. We got you, bro. We got you.
No, but honestly, it's actually quite a good idea
right?
to relax. No, but then what if you get a bit of pain with the massage and then you jerk and then you're in there?
It'll have to be one of the soft massages.
Soft massage. But it could be a really good. I mean, honestly, I'm not kidding. This is being serious.
Or a
Quite
hypnotherapist next to you.
Yeah.
You're enjoying this process.
This is actually really fun.
This is starting to be a one-stop shop. And then very soon you're going to offer like grocery shopping as well at some point. I don't know how it works.
I love that.
But let's talk about, you talked about the misconception, okay, that people should come in more often for a dental check, like more regular checkup. How regular should it be? Twice a year? Every quarter?
Yeah, I think twice a year is safe. It's a good one every 6 months just to get everything checked out. Everyone has different needs. I mean, some people, I think if you have no teeth or very few teeth, you don't need to come in so often.
Right.
But I think once a year is good. It's very good. Once a year is good. Twice a year is ideal, really.
Okay.
But yeah, it's different for everyone. But definitely don't leave it over a year, 2 years before you come and get things checked. Yes.
Talking of the fear and the misconceptions, is it also because people are just embarrassed or feel like they're vulnerable in terms of, you're going to see how neglectful I've been, or feel they get judged, when obviously you don't judge.
Do you need a support group, Shehzad?
Yeah, I need help. No, but I don't know. I'm asking. Is that?
Yeah, possibly. No, actually, that's very true. I've had patients who put it off and they come in and said, I've been very embarrassed about my teeth. I don't want to get them checked out. I don't want them to be looked at. But they're here now because they're in such agony.
Right.
Oh, dear.
Again, like you said, they keep it way too late.
Yeah, keep it way too late. But, I mean, I would like to reassure patients that that's why we're here. That's why we're there to help them. And don't leave it too long because it's not good for you and it affects you generally as well. It's not just your teeth.
You see thousands of sets of teeth, so it's just another set.
Exactly.
Of teeth.
It's just it's work for me. I don't judge. We're there to help.
Joanna wants to know: is it more stressful to treat dentists?
That's a really good question.
That's a good question. Yes.
Very good
Have you had to?
I have had to. I've had to treat my
colleagues and all
colleagues, friends, family as well. Family who are dentists as well. Yes, it is a little bit more stressful, but I think for both of us actually. And likewise, I have been treated by friends and family as well.
I wouldn't have done it that way,
So yes, it's a little bit more stressful, but at the end of the day, it's another set of teeth. It's just another mouth for us to look at.
Just another mouth.
Hey, this brings up, I'm going to start a new term, dental vision. It's where the dentists only see the mouth and the teeth. Dental vision.
Not the person.
Yeah.
Like tunnel vision.
Yeah, but
Yes, I
dental
like it.
vision.
Alun wants to know, the fluoride toothpaste at the end of the visit is usually very useful. He says, can it come in Coke flavor?
Coke flavor. Well, we've been asked this before. Coke, chocolate.
Yeah.
No, it cannot, because of the way comes down to the chemistry of how it's made and the flavors and the ingredients in it. You cannot make it into that kind of flavor. It's always a berry flavor. If you think about it, it's always a raspberry, blueberry, something like that.
Gotta love the irony of the two worst things for your teeth: chocolate and Coke.
Yeah.
And people want that flavor.
Because it makes sense. Why? I mean, if you're going to a dentist and you're not allowed to be eating a lot of these things.
So have that instead.
In
okay.
toothpaste form.
Yeah.
Yeah.
Dr. Mark, tell us, what are the three most common dental issues for adults?
So for adults, the three most common are tooth decay. So that's the biggest one. Tooth decay is actually like the second most common disease in the world after a common cold.
Yes.
So tooth decay is a big one. It's entirely preventable as well. So that one, that's gum disease. Gum disease, where the bone holding your teeth will become weaker. Periodontitis. Yes, many different forms of that. Yeah. And then the third one is probably tooth sensitivity. tooth wear, tooth sensitivity. Yes.
Okay.
Okay, we're just going to recap that as well. I think our listeners would love to hear that. And I think I'd like to ask you a bit more about gum disease, because it's not just gum disease. There are a lot of repercussions that could come out of that, right?
Yes.
All right, so we'll get you to elaborate on that maybe, because I've been having bleedy gums since I was 17. I did a root canal, and it just, until today, I still get bleedy gums.
Yeah.
Are you worried?
Bleeding gums can be a sign of many things. It can range from gum disease can range from simple inflammation, which is entirely reversible with some good brushing and oral care.
Okay, hang on to that thought. We're going to share with our listeners who also have bleedy gums. Okay.
Bruce Hornsby and the range, the way it is, the way your gums are right now, Cal. You're just talking to us about how things have been there.
We're talking to Dr. Mark Fung, who is from Smile Dentistry.
Smilepoint Dentistry, yes, Smilepoint Dental.
He has a great smile, and we were just discussing the 3 common issues that adults face when it comes to seeing the dentist. What are they?
So first one will be tooth decay, so cavities. Second one will be gum disease, and I think the third one will be sensitivity, gum recession sensitivity. Yes.
Okay, so I suffer from bleedy gums, and I've had this condition.
For how long?
Since I was 17.
Oh, God.
Yeah, I've had that issue.
But I hear a lot about gum disease, and sometimes when you're about to go for an operation or, go under GA or local, they ask you if you have bleeding gums or if you've done any dental work recently. Why is that?
Oh, yeah, why?
I think if you have bleeding gums, it could be a sign of several things. It could start off with just simple inflammation, or it could be quite severe, active, established gum disease, where your teeth are loose, mobile. So I guess if you're going for GA, they want to stick lots of tubes in that down your throat. They want to be careful with your teeth as well. And if you have any sort of fake teeth or anything like that, they have to be mindful of that as well.
I see.
Yes, yeah.
And what are the deeper repercussions of having bleeding gums? Like that can lead to heart disease or a sign of heart disease?
Yes. So another misconception is people don't think that your oral health is related to your general health as well.
Yes.
But it definitely is. In the recent years, lots of research has gone into this, and it's been proven that if you have bad oral health, bad gum disease, you have gum disease, bacteria from there can enter your bloodstream, affect your heart, and lots of other issues as well. And it goes the other way around as well. If you have systemic diseases such as diabetes, that can also show up in your gums as well. So it's a two-way relationship. And again, which is why it's important you go and get your teeth examined every now and then, because some patients have actually been diagnosed with diabetes as a result of their gums. So it's gone the other way. Yes,
right, that way around.
So you're saying that as a dentist, not only are you checking out dental health, you're like, I think you need to go and get your blood sugar levels checked. You might have heart disease. Really?
Exactly. Totally true. Yes.
Another problem that a lot of people face is teeth grinding. Is that something that's on the rise?
Oh, yes,
I'm
definitely.
one of them. Please.
Ever since I moved to Singapore, I've noticed a lot of people coming in with sort of sore jaw, sore muscles in their face, headaches, or teeth being ground down really flat.
Oh, gosh.
And this is definitely something that's come about more recently. And there's actually been some research into this. COVID, teeth grinding, stress. And stress is a big factor for tooth grinding. It's important this is looked at, because tooth grinding can lead to many other issues. Like I said, your teeth can start chipping if you have lots of fillings that keep failing, or headaches, unexplained headaches, jaw problems as well.
Right.
And again, this can also lead to other issues. Some patients who have a condition called sleep apnea, which is where your breathing and your sleep is disturbed, displays evidence of teeth grinding as well.
Yeah.
So that's important to be looked into as well.
And because when I've talked to my dentist before about it, and you need a mouth guard would be the
which
are there solutions to this besides the mouth guard to protect the teeth from being grinded down?
Depends on the severity. Monitoring, mouth guards, or you could look at Botox as well. I'm not sure if you heard about Botox.
I've done that because it's bruxism, right?
Yes, it's bruxism. It's bruxism. That's exactly
I went to a doctor who looked at my cheeks and said, well, in terms of muscles, yours would be the equivalent of The Rock in your jaw. That's how bad it is.
You need to enter in an MMA competition.
Yeah. So I had to go get Botox in my jaw to relax the muscles there
Yes.
because of the teeth grinding in the first place.
So you have teeth grinding too, Carol.
Yeah.
So
And
that stopped
That
now?
helped after the Botox?
It did. Like, there's so much tension in my face, it would lead to migraines sometimes.
Yes,
It's
yes.
so
Wow.
uncomfortable
Yes.
to just talk.
Yes,
Oh.
yes.
Yeah.
Migraines, headaches, limited jaw movements.
Yeah.
And that's exactly what the Botox does. It freezes the muscle for a few months, so therefore you're not clenching as much. Your
Yeah.
muscle activity is lessened, and it does help.
It
Yeah.
does,
Yes.
it
Can
does.
you do that at the clinic, at a dental clinic, like Botox
Yes.
specifically for the jaw?
Yes, absolutely.
And then you
ma-
shift a little
Ooh.
bit upwards for me, for my crow's feet.
Absolutely,
If
we
you
can
do
do
a
this.
few, you can do a few more for my
Absolutely.
forehead.
No, just joking, just joking.
All right, we're chatting with Dr. Mark Fung from Smilepoint Dental. Join us on Facebook Live, facebook.com/1FM 91.3. There's a chance for you to win a $100 voucher from the Thai Spa for a 60-minute massage, something we're suggesting to Dr. Mark to include at his practice, yeah? Back with more in just a bit. So much to be revealed in the world of
So
dentistry. Did you know
interesting.
about the heart disease thing?
I read
Yeah.
it, but I didn't realize, and now it's seeing it in a different light, about how it's a two-way thing.
Yes.
And even when we talk about teeth grinding, I mean, maybe there are a lot of sufferers who suffer from these migraines and all that. They might not realize it's due to the teeth grinding, like the overuse of the jaw muscles.
Exactly.
So going for a regular checkup can help with all these.
Yes, because your dentist can see. They'll be able to see and have a look around.
Would
see
you
the
tell
signs.
them? Would you tell them?
Yes, absolutely.
Uh-huh.
Yes, absolutely.
And
yes.
you can, so again, you could actually do the treatment using the Botox for the jaw muscles in the clinic itself.
Yes, we can. You just need to make sure you have a dentist who is qualified to do
To do that,
Botox.
right.
Yeah, I
Fair
did
You're
enough.
not just going to anyhow go in there with a needle.
Yeah, of course.
yeah,
of
but we can.
course.
Yes, we can. And some dentists are qualified to, again, give it a bit higher up on the eyelids and,
Really?
and stuff like that. As also can.
Are you serious? Or are you
Absolutely.
joking?
No, I'm absolutely serious.
Because they
and
have to go
only-
for the training for like
Exactly.
the right, and so
Yes.
it actually covers.
I'm telling
Yes,
you,
it
dental
covers
spa
both.
is the way forward.
Guys, we have
That's
stumbled
absolutely
upon
true.
something here.
Yeah.
Mark, remember us, okay?
Look
I
at the
will.
We'll be the
excitement.
founders
Look at
of
the
this.
excitement from Lavi right now.
Hey, seriously? Okay.
Seriously,
Okay,
yes.
here's my thing. So grinding, right? My husband does it. I do it. But I have Invisalign, so that helps. My husband has a mouth guard, but my son, he's only like 7, so it's a bit hard to get the mouth guard. We have to keep changing it. All that,
Yes.
right? Can he qualify for Botox, or is there an age limit to it?
Wouldn't do it so for children. Just
Yeah.
yet.
Oh, he really wanted to fix his crow's feet. Wow. No, I'm just joking. So, how young can you start the Botox thing for the jaw?
I think definitely when they're young adults. Yeah, I wouldn't. As kids, we will
When
not.
the jaw's
do
not
Botox
probably
just
probably
yet.
fully
Yeah,
formed, right?
muscles as well.
see.
And for children,
For teeth grinding, what's the solution then?
yeah, you have to look at again children slightly differently. You have to think about if there's any other issues there as well. Is their sleep being affected? How is their quality of sleep?
Okay.
How are they during the day? Their concentration levels? Because again, teeth grinding can be a sign of other issues in children, such as airway being blocked. If they're snoring a lot, if they've also got sleeping problems, they should also
Okay.
be checked out.
So-
Because checking the
wow.
tonsils, the glands at the back of the throat, and also how their jaw is forming as well.
This is really,
Yeah.
really enlightening, because now I'm realizing that there's so much more into why you do have to go twice a
Yeah.
year. A lot of us thinking like,
There's
just
so
clean
many
your
other
teeth,
issues, right,
clean
that
your
could
teeth
go
and
on
all
issues.
that.
Yeah.
Yes,
But
absolutely.
wow.
Absolutely.
Yeah,
And
I've got even more respect for dentists now.
teeth grinding can be a sign of behavioral problems as well, such as ADHD, things like that. So it always needs to be looked at. Absolutely.
Wow. But are these some questions that you ask your patient?
Yes, yes.
When you
Ah,
observe teeth
okay.
Yes, a patient comes in complaining of teeth grinding, or I see it. I will ask them other questions. How's your quality of sleep? How's your child's sleep? Breathing? Are they snoring? Are they complaining of headaches as well?
Like all dentists would ask this, or is it just you?
I think a clued up dentist about teeth grinding, yes. but I think it's not something that should be just brushed aside. It needs looking at. Yes,
Brushed aside.
Brushed aside.
Hey, I love
1
it.
point for the dental
Comedian
puns
as
there
well.
to Dr. Mark. Yes.
Just picking on something you said there, breathing. Because is that an issue? Breathing through your nose, your mouth for dental. Problems?
yes. So for children who are complaining of clenching and breathing through mouth a lot, we will look into their airway, and we might even refer you to ENT and get them to check that out. To make sure nothing's blocked, and make sure the jaw is forming properly as well. Yes.
So again, reiterate that breathing through your nose is a lot better for you than going.
Absolutely, and that's been well established as well. Breathing through your nose is a lot better than breathing through your mouth. Yeah.
Okay.
Hannah wants to know: are there any specific diets for teeth health besides regular brushing?
Great question.
Foods you can eat.
I think. As with most things, everything in moderation. I admit I have a sweet tooth, so I think diet-wise, it's limiting sugary items, all the fun stuff. Unfortunately, I mean everything in moderation. Just not too much snacking, because the frequency of eating affects your risk of cavities, but also the content and the amount of sugar or starchy items as well.
How about if you brush every time you snack and indulge?
Yeah, I mean would
that help?
That's also possible, but then that comes with other problems of overbrushing.
Overbrushing.
So you overbrush, you could damage your gums,
enamel,
recession, enamel, wear your enamel down. I think if you have like your 3 meals a day and 2 snacking sessions during the day and brush twice a day, that's okay.
Wow, yes. 2 snacking sessions. Dr. Mark is extremely generous there.
Actually, on that point, what about flossing? Like, like in some, in it seems to be in America, for example, like flossing is, if you don't do it, that's kind of weird. But what do dentists feel about flossing overall? How
definitely
important?
Floss.
Okay.
Do you not get the complimentary flossing at the end of your dental session? Like my dentist always does that to me. You should be flossing. This is how you floss.
Yes.
And I'm like,
it just
I'm 12 again.
A lot. I think people. It's good to hear it from a dentist. So yes, it is vital. Would you say?
I would say vital. It should become part of your daily regime.
Absolutely. Twice or once a day?
Once is okay in the evenings. Twice if you can. But definitely end of the day where food can get stuck in little gaps in your mouth, in your teeth, and just get your floss in there. It takes 30 seconds, not long, and it really does make a difference.
Yeah, true.
I have questions on that. So one, children, the topic of flossing for children. I know some parents who actually start them really young. What do you recommend with kids? And also electric flossers, those water flossers. So go.
For children and flossing, a lot of children lack the dexterity. They can't get their fingers in there to do it, for starters.
And even for parents, their mouths are so small. I'm just like, hey, this is not working.
And essentially, for me, my approach is just get the child to brush twice a day first with toothpaste. And when they're there with that and they're good, get the floss in there.
But there's those little flosser things.
The one that's like a
yes. Yeah,
those are easier.
Those are easier.
Yeah.
So use those.
Use those. So for children, floss if you can, but not so important.
The electric water flossers that she was mentioning.
Yeah, and electric water flossers have been shown to work very effectively. If you can't get in there with the floss, manual floss, normal floss, use the electric floss. But there's no need to go out and buy a new electric flosser straight away.
But I love shopping.
If you want to spend, then go ahead and spend. But normal flossing is also good enough. Yes, but the electric flossers do help. Yes.
Ooh.
What about electric toothbrushes?
We'll handle that on air.
Okay.
In the meantime, Matthew wants to ask, how do you handle gum disease in seniors?
Yes.
Gum disease in seniors, I think, again, it's something we will look at. How many teeth they have, how bad is the gum disease. Normal gum disease treatment will involve deep cleaning to get rid of anything stuck in there, and that's what we will normally do for seniors as well, actually. And then but when it comes to older seniors, we have to also look at the entire patient and how many more teeth do they have? Are they motivated to keep their teeth clean as well? Because I see your patient for a snapshot of time only.
True.
It's really down to the patient as well, and how motivated they are to keep their teeth as
Motivation, you see spa.
Then you have a wellness coach inside. You know, the room. And
it's getting better.
Yes.
We're going to jump back live on air, Dr. Mark, wrap up our little chat, and we're going to be asking you for 3 things that you would want everyone to do for themselves, when in between coming to the dentist, and also the efficacy of electric toothbrushes as well, because I only recently jumped on the electronic toothbrush bandwagon.
Ooh, fancy.
So that's coming up.
This is how you get your kids started on great music and when they're learning to count. 1, 2, 3 by Gloria Estefan.
Or brush their teeth.
That's true.
And that's the number of things that we want to ask Dr. Mark, right? The 3 things.
Yeah, exactly. Dr. Mark from Smilepoint Dentist. Thank you so much for joining us this morning. We've been talking about all things dental, gum disease, teeth grinding, Botox for people who have bruxism, electric tooth flosses. So on the topic of electric, what are your thoughts on electric toothbrushes? Yay or nay for you?
Yay. It's a yay for me.
Yeah.
Oh.
They really do clean well, and they've been shown to clean efficiently as well.
Better than manual.
Yes, yeah, better than manual. But again, if you are okay with your manual toothbrush, don't go brushing and buying a new electric toothbrush if you don't need it.
But here's a
They do
question.
work.
Because a lot of dentists would say oh, don't overbrush, use a soft bristle, right? Or that. Will the electric toothbrush sort of counter that?
Yeah, so actually a lot of electric toothbrushes nowadays have a pressure sensor on as well. So if your problem is overbrushing, causing recession, sensitivity, and your dentist has told you you're using too much force when you're brushing, maybe you can look into an electric toothbrush, one that tells you if you're pressing too hard. They normally light up or they will stutter a little bit. So again, that again, and it's also electric toothbrushes and kids as well is also quite good because it improves their compliance for brushing. They see it as a toy.
Yeah,
Yes.
like, especially when it's got like Barbie or Spider-Man on it. I think,
And
Exactly.
I do believe some of them have a 2-minute timer, which is the length of time you should be spending on brushing
I need
your
that.
teeth.
So I only got on the electric toothbrush bandwagon this year, and on the box it says 100% better than a normal toothbrush because it's
Whoa.
more efficient in getting
Right.
rid of bacteria and all that kind of thing. Yeah.
Yeah. 100% is a bold statement.
I know. I was
I guess it depends how good your brushing was with a manual toothbrush or how bad it was.
because I'm quite lazy when it comes to my toothbrushing routine. It's done in 15 seconds, and then but I go okay teeth, right? But yeah, definitely, because with the toothbrush you don't need to move things up and down, left and right. You just hold it over your teeth. You just move it slowly over your teeth.
Yeah, electric toothbrushes make things very easy for you. So if it works, then get one and use it. Yes,
I'm going to put him on the spot. Do you use an electric toothbrush, Dr. Mark?
I do.
So if your dentist is doing it, you should be doing it. And finally, what are 3 things you want everyone to do for themselves in between visiting the dentist?
Yeah.
The main one is make sure you do go to your dentist for regular checks, even if nothing hurts. Brush 2 minutes every day with fluoride toothpaste. Please use your floss. And also seek help if you think you need it. If something's not feeling right, seek help. Come to us, please. Don't put it off. Yes.
Oh, and should you be spitting out your toothpaste and gargling after?
So the advice is just to spit out and then try not to gargle.
So what do you do?
I brush my teeth, then I just spit out. I don't rinse my mouth afterwards because you want to leave the fluoride toothpaste in there on your teeth.
But for kids, because
for kids,
they should
the problem
rinse it
with the problem with kids is if they swallow the toothpaste.
Yeah.
Then you should
Which would
encourage
happen,
spitting
right?
and rinsing. Yeah, absolutely.
So is it enough for them to just spit it out? But they should rinse for kids. For kids,
I think for kids, maybe you should encourage spitting out to begin with. But if you are worried of them swallowing it, then get them to rinse. Yes.
Okay.
Yeah.
That's why we were taught that way in primary school. We all had to brush our teeth after recess. We had these little tumblers and toothbrushes, like in primary 1 and primary 2. They make you line up in a line after recess, and you have to squat down and brush your teeth, use the toothpaste, spit it out.
Yeah.
But as adults, we're discovering that you shouldn't be rincing after your brushing.
Yes.
Wow, I'm not sure if I'm used to that, man. I need to rinse
Yeah.
out.
But then because you've still got it
in your mouth. But that's how
Got that minty flavor
well,
in
at
your
least
mouth.
now it's not so weird, because I remember there was a friend once brushed his teeth and then he just wiped it off, and I was like, dude, what are you doing? Gross. And
But
he was
that
like, no,
is-
what? This is, now I know he's right and I was wrong.
Was
Okay,
that Joel?
fine.
Producer Joel. All right, Dr. Mark Fung, thank you so much for joining us this morning. Where can people find you?
I'm located at Smilepoint Dental in Holland Village, or Dental Plus at Telok Blangah. Thanks for having me. It was really good.
It's been a great
you.
chat. Are you on social media? Can people see your teeth?
You see it now.
Yeah, but feel free to contact me through the websites my work websites. Yeah.
And that's
Very
Smilepoint Dental?
Smilepoint Dental and Dental Plus.
Okay, great.
Yes.
Thank you so much,
Thank
Dr.
you.
Mark.
Thank you so much. Thank you.
Good times. Greatest hits. 1FM 91.3.